The HealthQRS platform can be configured and deployed in many useful ways depending on the needs and role of the user. In this example, we see a simple form of self-navigation where the user is asked a series of questions to help navigate them to the best option or options for their care. The platform begins by asking the user, who needs medical attention, giving the user the option to select themselves or someone else linked to their HealthQRS account, such as a child. On this screen, we see options for the user to select themselves or their 14-year-old son named Robert. The user selects, I am looking for myself. The next screen asks, what would you like to do? The screen lists actions the user can take within the HealthQRS platform. Most importantly, if this is a life-threatening situation, the user should contact 911. The emergency option will call 911 from the user's smartphone. In non-emergent situations, the HealthQRS platform can help the user to make an appointment, manage a prescription, or find a primary care physician affiliated with their health insurance plan. The user selects Make an Appointment. Next, the HealthQRS platform asks, what type of appointment would you like to make? Several options are provided to the user based on their profile, from well visit to sick visit, from flu shot to referral consultation. When the user selects Other at the bottom of the screen, the user can enter in a procedure name, procedure number, or even a partial description. The HealthQRS platform would then help the user select the appointment or procedure type that best fits their medical need. The user selects Sick Visit. When do you need medical care? Now, at the first available, or my schedule, my choice. Now means right away. The HealthQRS platform will check across the network of providers and look for appointments right away or over the next few hours. First available means soon. In this option, the HealthQRS platform will scan the network of providers and find appointments that are available today or over the next few days, depending on the type of appointment or procedure you have selected. My Schedule, My Choice allows the user to find appointments based on their own availability. In this option, the HealthQRS platform will scan the network of providers for appointments available over the next week or across any date range, including time of day. The user selects First Available. After the user selects First Available as the appointment option, the HealthQRS platform displays the service or facility types that are available to the user. Patients seeking the appropriate level of healthcare service is one of the biggest drivers of cost in the healthcare system. The HealthQRS platform can limit location options by insurance plan, prioritize options by cost, or display additional consultation strategies. On this screen, we see the option to schedule a teledoctor service or video chat session with a doctor for later today, which is a service with a $0 copay. The user also has the option to find low-cost or free clinics that are close by. The user can also choose to go to their own primary care physician. In this plan, there is a $10 copay for a sick visit to the primary care physician. For Medicaid patients, the copay may be less. Finally, the user has the option to connect with a nurse advisory hotline, which will assist the user in identifying their medical need and scheduling an appropriate appointment. HealthQRS can also aid the staff at the nursing hotline to identify resource availability, determine cost of relevant options, and to schedule appointments for the user. Notice that in this example, going to the hospital was not a suggested option. Without the HealthQRS platform, the user may have made an avoidable trip to the hospital and incurred a much higher copay of as much as $100. The HealthQRS platform further reinforces that the hospital is for serious health issues. In this case, the user selects Primary Care Doctor. The HealthQRS platform maintains a directory of service providers and locations, cost of procedures at each location, and an inventory of available appointment times. Here, the HealthQRS platform displays the list of available times based on the user's request for first available appointment options for a sick visit with their primary care physician. The user selects the first available time on Tuesday of 11:14 a.m. with the $10 copay. The HealthQRS platform provides a picture, name, and address for the location, in this example, the user's primary care physician. A convenient location map is also displayed in case the user is unsure of the location or needs to consider travel times and transportation options before booking the appointment. The user selects Book Now. The HealthQRS platform displays an appointment confirmation and a summary of the service that was scheduled. The HealthQRS platform also tells the user that they will receive a reminder a day before the appointment and gives the user options to set other reminder times. The HealthQRS platform was designed with payments in mind. An option to pay the $10 copay in advance is presented here. The patient will be prompted to pay the copay again when they check in at the provider facility. In addition to seeing a location map, the user can get directions and find alternative forms of transportation, such as public transportation, Uber, Lyft, a medical taxi service, or any other community-based service that provides transportation to those who cannot afford it. Finally, and as a last resort, the user can cancel or reschedule the appointment. HealthQRS will keep the healthcare provider informed of any changes to the scheduled appointment. Users can edit appointment reminders to meet their own needs. Reminders can be saved to the user's own smartphone calendar, sent to the user's email, or sent as SMS text messages. When the user receives an appointment reminder, they are asked to confirm their anticipated attendance, reinforcing the importance of being present at all scheduled appointments. If the user needs transportation to an appointment or procedure, convenient transportation programs and service options are displayed, along with their criteria for service usage. Users can connect to the option of their choice with a simple one-touch connection. When the user arrives for their appointment, the front office personnel at the healthcare facility is asked to confirm the identity of the patient. Identity validation usually includes verification of insurance and current address and contact information. With HealthQRS, front office personnel can gain additional validation by matching the patient with the picture the user captured when they signed up for their health insurance plan, or the front office personnel can send a validation code through the HealthQRS platform to the user's smartphone. Here, the user has been sent an appointment validation code and is prompted to provide the validation code to the front office personnel to complete the check-in process. The front office personnel input the user validation code provided by the user to complete the patient validation process for this appointment. This two-step validation process significantly improves the probability that the patient in the office is the same user that registered for the plan. The patient validation is now complete, and the front office personnel can continue their normal check-in routine. The HealthQRS platform can also provide customized preventative care reminders based on AMA, CDC, Health and Human Services, and state Medicaid guidelines. The reminders are based on a template of preventative care customized by age, sex, and user's self-identified health history and concerns. When the user selects a reminder item, they are navigated step by step through the process of making the appropriate appointment, finding the appropriate location for the activity, or setting a customized reminder to ensure proper follow-through at a later date. Parents or caregivers can also see the reminders for their healthcare dependents. The HealthQRS platform tracks user and provider activities across the entire process, drafting reports on benefits dollars demanded through the platform, active users within the platform, copay dollars collected using the platform, appointments scheduled within the platform, members validated through the platform, user transportation requests through the platform, and more are as easy as using HealthQRS. Reporting is available by county, by regional care organization, by district, by service provider, by procedure requested, and more. The HealthQRS platform captures the retail demand for service and user retail behaviors. When combined with historical claims data, a unique 360-degree picture of demand, fulfillment of demand, and total program costs can be achieved. Reports can be securely shared within the system or pushed to key executives and program personnel on a regular schedule. The HealthQRS platform is an innovative solution to the complex challenges of today's healthcare system. By guiding the user through options for care and offering solutions to many of the barriers to patient follow-through, both the user and healthcare provider are benefited. HealthQRS, where better health takes flight.